Good evening and welcome to this webinar, which is being hosted by Green World. My name is Sujit Menon, and I also have our host and speaker for this evening, Mr. Jayandran Mohan, who would come up on your screens in a brief while. I'd like to thank you all once again for joining us. It's just 7 p.m. local time here in UAE. And for those of you joining us from Saudi Arabia and India, it's definitely 6 p.m. and 8:30 p.m. as well. Rest of you from the other parts of the globe, we welcome you on board for this quick webinar from Green World, which we do on a regular basis. And our topic for this evening is the COVID-19 PBSA in short, which is the Pandemic Behavioral Based Safety Analysis. The speaker for this evening, Mr. Jayandran Mohan, is a very distinguished individual with a wealth of experience, not just in health and safety. He would obviously give a formal introduction of himself. I wouldn't want to spoil the fun as well. Just before we get to the webinar on board, we'd just like you to explain on who we are and what we do. As you'd see on your screens, we go by the name of Green World Safety and Security Consultancies. We have been there in the industry for a little over a decade and a half, and we've started off with training as a primary, I would say, activity, and thereby just gradually moving on to and diversifying into several other aspects. We've been in the training forte for almost more than a decade by having accreditation with several UK-based providers, I would say awarding bodies, and gradually have gone up to many other awarding bodies in the US and other countries as well. So we started with a bit of a foray into consultancy services and ISO preparation services. We also take up specific approaches on projects management for HSE. Basically, it is to set up a company with their health and safety policy and get them prepped in their day-to-day operations as well. Just to give you an idea of where our omnipresence is, the COVID-19 pandemic, which is going to be the center of our discussion this evening, has really put us in a very challenging and difficult position. So obviously, the only way to reach out to most of you at the moment is via technology that we have here, and there are plenty out there in the market. But so this being the Zoom webinar is one of them, where we are able to actually tell where we stand in terms of the training and delivery. Obviously, this has been a dent for many of us with the challenge that. Classroom-based training is no more the norm. The new norm is to maintain a social distancing, and of course to try and see how we can, get ourselves across to you from being apart as well. So we have trained with our history at least about 77 different nationalities, and we are across 195 countries, and that's just expanded. I should be honest, though, the statistics that you see on your screen is a little over a couple of months old, so we would definitely be updating the same over the coming weeks. And what you see on the bottom half of your screen are the associations we are with. The top ribbon that you see here are the accreditation providers that we are associated with, and definitely we are one of the proud learning partners of NEBOSH, being a gold member. We are associated with IOSH as well, and a lot of other awarding bodies that you see here on the top. We are also associated with a lot of the regulatory bodies across different countries. So if you see in Saudi Arabia, we are associated with the TBTC, which is just as similar to the KHDA that you have here in Dubai, in UAE, and also several others like the municipality, the civil defense, and a little bit more. I mean, if I had put in all the icons, we would actually fill up the screens. So we just wanted to let you all know that we are there, and we are there for sure, right? Just before I hand over my reins to our speaker for the evening, I'd like to just give you some statistics in numbers of what we've achieved so far. We've just done a little over 41,000 IGC student registrations. IGC stands for the International General Certificate, which is the NEBOSH qualification. I'm aware that some of you on the webinar today would have already taken this qualification, while there are some who are probably hearing it for the first time. So once we are through with the webinar, at the very end, we would put up our contact details and you would be able to get in touch with us. And while we do that, we would also like to take mention of certain ground rules. So the webinar would be podcast as we speak. A recording of this webinar would then be posted on our website. So just in case you join us in between or you have missed a certain part of the webinar, you can always view a section of it at the end of the session as well. And it will be posted on our websites tomorrow. We will share a link and you will be able to access all our sets of webinars that we have been doing. So you'll also see there are several other webinars that we have hosted over the last few months. And we've got some more lined up in a couple of months. So please do keep a lookout on our web pages, on our social media channels. You would be seeing a lot of information that we will be broadcasting in the coming months. And for this session, we would have a Q&A section that would be at the end of the presentation. The subject expert, which is Mr. Jayandran, would take the questions and we would pick it up from the Q&A. We would try and answer it on the go. And if there are still questions that are left unanswered after the allocated time, we will be more than happy to get back to you. Leave us your contact name and number. We would get in touch with you once we're done with the session. With that, I'd like to not take further time. I would just take a brief break just to change screens, and my colleague, Mr. Jayandran, would take over from here. Thank you so much once again for joining me. I shall come back at the end of the session. Please stay connected. We have Mr. Jayandran, who would start in just a little under a few minutes. Thank you.
Yes. So good evening to all. My name is Jayandran Mohan. One of the hot topic now, as we know, COVID-19 pandemic behavioral safety analysis. Completed my Bachelor of Technology in Chemical and Research in Safety. Process Safety Consultant and HSC Trainer. Regarding with COVID, I completed this certifications from WHO. And then from Highfield, I completed this qualification like infection prevention and control. And how can we secure COVID-19 in office and retail? Like how can we work effectively in office and retail spaces? And finally, what are the behavioral safety aspect and mental safety aspect and COVID sessions? And then these are my volunteering activities. I developed COVID-19 biological risk assessment for learning centers and education institutions. Being a chemical engineer, now I'm doing a deep research study on different disinfectant chemical against COVID, like alcohol-based, chlorine-based, non-alcohol, non-chlorine-based. Among this, which disinfectants we can use effectively for COVID. Because even though there is a COVID, we have to move forward. The people who are working in confined space, chemical fumigation method using it, so that we can enter inside the confined spaces. Like people have to work inside the confined space, they have to work near hydrogen sulfide gas areas. So they have to don definitely respiratory protective equipment and face pieces. So because of this COVID, we have to know, we have to identify a disinfectant chemical which will not cause skin irritant and mucus irritation and respiratory problem, but it has to kill COVID. So keeping these criteria in mind, I identified a few disinfectant chemicals, and I'm suggesting for the learning centers to use these disinfectant chemicals against COVID. And lastly, researching about behavioral based aspects of COVID-19 control, how the COVID stress symptoms, many people are working from home, how this behavioral safety aspects can be controlled. That research is also I'm doing it. Like this webinars and CPDs, time to time, I'm delivering whatever research I'm doing, whatever the data I'm gathering, I'm delivering webinars and CPDs to the community about the COVID infection control mechanisms. As of now, this is my volunteering activity regarding COVID-19. So today's topic, as I told you, pandemic behavioral based safety analysis. So in this topic, we are going to discuss all these 4 points. First of all, elaborating obsessive compulsive disorder, OCD, and germophobia. And then the second is understanding COVID-19 hierarchy of control, and then moving into elements of behavioral-based safety. And finally, I'm going to discuss a survey report about pandemic behavioral-based safety. The main idea of this webinar is to bring a general understanding about behavioral-based safety and how is it important in general safety domain, irrespective of any industries, how this BBS is very important. And second main idea is, yes, COVID-19 is taking its second phase and is spreading vigorously. There is no need to scare about COVID when we have to get a proper awareness. What is proper awareness? What we can do and what we should not do. If you have the clear idea about what do's and don'ts and proper awareness, definitely we can have a good control on the COVID. So to spread the awareness and to create a good understanding about behavioral-based safety, we are conducting this webinar. So this OCD is our topic as I discussed. First is, what is this obsessive-compulsive disorder? Repetitive, uncontrollable thoughts or urges is what we call as an obsessions. And because of this obsession, repetitive behavior or mental acts that the person feels compelled to perform, that is compulsion. So because of this uncontrollable thoughts, we are forced to do something, that is compulsion. So obsession and compulsion. Right. So you can see obsessive compulsion disorder, OCD cycle. Okay. So first one is obsession, worrying thoughts. First, it will start with worrying thoughts, like I touched the door handle, maybe I pick up the germs, right? And from there, worrying thoughts, it will come to anxiety, right? It will rise the feel of anxiety and fear. From the thought, now it will come to fear. Because of the fear, I will compel to do something to come over from my fear, right? And after that, there will be, I do something to relieve myself. For example, obsession, I touched the door handle, I will say myself, I may pick up the germs, that is obsession. Because of this, I am getting a fear, I may get infected. Because of this fear, I will go and I wash my hands repeatedly again and again. After few washes, I will feel temporarily relief for few seconds. And after that, again the thoughts will come. In short, the person who has the obsession will do the same activity again and again, maybe 20 times, 30 times. Like that, he will do the activity again and again till some extent. And after that, he will stop the activity. Usually, if you touch anything, each of us, okay, each of us have the feel like, each of us have the feel. Now it's audible. Great. So each of us have the feel. We have a germ. That's a normal one, and we wash our hands 1 or 2 times, and then we'll go back to our work. But the people who are having this OCD, they will do this repeatedly again and again. That's the difference between a normal people and the person with OCD disorder. Okay. So what are the common worrying thoughts we have? Fear of blood, body fluids. Always some people are concerned about order. If there is any slight change in order, they don't accept. Okay, even though they complete the task, they ask themselves whether I completed it properly. Even though they completed, they will ask themselves, worrying about task completion. Okay, excessive washing of hands, brushing teeth many times, repeatedly checking the door lock, furnitures. Before sitting into the chair, they will check whether the chair is in a good condition. Each and every time they do that. Repeatedly turning off and turning on the lights, going in and out of a door, sitting down and get up from a chair, touching a specific objects for several times. Okay, organizing, always they want everything, 200% organizing, counting a number again and again. Even though the paper is old, their mail is old mail, they don't delete it. Before taking any work or after completing a work, they will always ask a constant approval and reassurance. Okay, they always say they are hearing some music again and again and again. They are seeing some images. They are seeing some words, numbers, right? And then they are afraid of a family member. On seeing a specific person, they always show the afraid much. Again and again, they show all these symptoms. And finally, fear of dirt and germs. So there is no problem if you have a fear on germs, but if you are doing it, if you are overdoing it, then there is a problem. This is where our discussion starts. So The overfearing of dirts and germs is a symptom of obsessive-compulsive disorder. In psychology, it is termed as germophobia. So there is no problem if you have a fear on germs, but it should not over beyond the limit. And then comes germophobia, right? So how this OCD, the germophobia is one part of OCD actually. So the germophobia is the pathological desire to wash one hands and body. So they always want to wash hands and body again and again. It also involves a fear of dirt and contamination. Okay, germophobia is also called as mysophobia. These are the different terms, but the idea is same. They always have a fear for germs. I look the questions in between so that I can see whether my internet is going fine, so that I can get an idea. Okay, thanks. I think so far so good. Great. So germophobia is like this. Okay. I like to share one video, but I'm not sure what about the wavelength. Let me check with the bandwidth. I will share one video now. Just a second. I hope the net goes well. As it is evening time, everybody is using net and nothing to say because of COVID. Right. I'm sharing one video. The person who is having the phobia about germs, how he will behave. Just a second.
If I even hear someone talking about being ill, I panic. My fears have also taken over my family's lives. I homeschool the kids because I don't want them going to public school where you can contract a stomach bug. Jesse has fears of getting sick and getting germs as well because of me. My daughter, Julia, also has anxiety. She rarely likes to leave the house. A few years ago, she didn't leave the house for almost a year. I'm afraid my youngest, Cody, will contract a stomach virus, and the rest of us will get ill because he's 3 and he touches everything. I want more than anything else to have a normal life for me and my children, but it's not possible.
Okay, Janine, how hard is it for you to be here today?
Extremely.
Tell me what it's been like to come out of the house, travel on public transportation, come here, go through all of this.
My anxiety is horrible right now.
Yeah.
It's been extremely difficult. Look at the hotel room. I guess you never know what's happened before you've been in there. So I wasn't sure. You hope nobody's been sick before you stay there.
Right.
So I did bring my wipes with the special cleaner in them and wipe stuff down.
So you worked the room over?
A little bit, yeah. The door handles, the bathroom, the remote, the switches.
Tell me what's driving you.
It's this horrible fear of the stomach bug. I have this irrational, horrible fear of the stomach bug. I get panic attacks. I don't understand why.
What is the fear? What's going to happen if you get sick?
Right now, my biggest fear is for my youngest child getting it. I don't know, I'm not sure why, but I think of him waking up in the middle of the night and throwing up, and I panic, and I don't know, and sometimes just thinking about it will snowball me, and I'll go sleep in my car at night, so I don't have to worry. I feel safe that nobody wakes up in the middle of the night and will get me up because I'm trapped in my car and I lock my doors. It's always the nighttime. It's always the dark time when my anxiety seems to be the highest. I sneak out and I sleep in my car. My car is my quote-unquote safe place. If I'm having high anxiety or close to panic attacks, I come here to escape. I can lock the car. I can be out here by myself. If my mind is racing and I'm afraid my son's going to wake up sick in the middle of the night, I grab my pillow and stuff and I sneak out and I sleep in my car. In the morning, as soon as it gets light out, I start to feel better. I go back inside.
Janine does a lot to avoid getting the stomach flu. Like she keeps the kids indoors. She tells the kids not to touch her face. The children are homeschooled. She never uses public restrooms, which means you go before you leave, and you come home before you have
Hopefully.
to. Yeah. So you won't go to movie theaters.
I don't like to, no.
The 3-year-old son has barely been outside, right?
Yeah, I'm okay, like, outside our house and, like, being out in nature, but I don't want to go out, like, I don't take him to a park or stuff because of the equipment.
Yeah.
You know, like I'm afraid that.
And you wipe down all the surfaces with disinfecting wipes. You order boxes of cleaning products daily.
Well,
because you stay stocked up.
I am
Let's put it that
stocked.
way.
I am definitely stocked.
You have several bottles of hand sanitizer on you at all times. You have sanitizer wipes on you at all times. You often wear antiviral face mask.
I do if I'm at home and somebody is ill, I'll do that, or going to a doctor's office, I'm afraid. So I'll take it with me. I always have one with me just in case.
So what you have seen is not due to the corona time. Okay, even if it's the corona time, we can justify this. So germophobia, what you have seen the video, it is not shooted during the COVID time. It is shooted 4 years before, something like 2017, 15, 16. That period, the video is shooted and uploaded in YouTube. So this, you can see how this germophobia has affected that woman life actually. So this is what I am trying to say, the OCD and germophobia, right? So yeah, so you can see that many of us have this fear. Some very few have this OCD fear. A brain can develop a strong fear of germs, including the ones that are actually beneficial. And they always get a compulsion to wash their hands again and again and again and again, right? Many people who suffer through germophobia have the compulsive feeling to wash their hands constantly and consistently. Many people realize that their constant washing is ridiculous, but yet they will be forced and compelled to do wash. And it's a pathological need to stay away from germs that motivate germophobes. That one way it is good, but always overdoing is the problem, and it will affect the normal life of people of this category. So they display some behavioral issues both in public and private. They don't go for, yes, you have seen that, they don't go for restrooms, they don't go for movie theaters, they don't go for parks, they don't touch anything, they don't move with the people very easily. They constantly keep on washing their hands. They don't go for any social settings and parties. Okay, they don't touch doorknobs. Even if before touching doorknobs, they take the wipes. For them, washing their hands is like a ritual. So these are the behavioral issues they will face. Right. Now that's a question. Can we wash our hands? Okay, washing hands is good. Right. If again, if I wash my hands with soap water or with a sanitizer or with a bleach, what happens? What will happen if you continuously wash it? You can see dermatitis, especially for the inner palm. You can see swelling, skin allergy, and dermatitis. That will happen. Secondly, because of this feelings, they cannot move with the proper. They cannot move with the people very effectively. That will isolate them. That will increase their stress level. That will completely keep the people, these people, away from the community. Not only them, it will affect their kids. We have seen in the video. She is saying she will not allow the kids to go out. She will not allow the kids to go to public school. Totally, it will affect the normal person life. Right. That's what the germophobia. It works like this. So now we can relate how this OCD and how this germophobia is connected with COVID now. So I hope you have seen in the search engine, there's a new problem now coming up, COVID stress syndrome, CSS. That's what the main topic is today. The COVID stress syndrome is characterized by 5 phases. One is, as I told you, danger and contamination fear, the germophobia and OCD. Another one, okay, that's okay, socio-economic concern. And then xenophobia, one more phobia now. Xenophobia means the people coming from this particular region, we should not talk with them, we should not go with them. The people coming from a specific country, don't go near to them, that kind of fear. And because of that, compulsive checking and reassurance, again they check themselves whether they have a corona. And finally, all this connectively end up with stress. So they cannot sleep properly, their normal life is getting affected. So this OCD and the germophobia and other factors combinedly causing this COVID stress-related symptoms. So this is COVID stress-related syndrome, right? So I'm not saying don't fear, be careful on COVID. Don't get scared about COVID. That is the message of the webinar, okay? So moving forward, Right. So now we entering into a very important main topic of today's session, COVID-19 hierarchy of control and behavioral based safety. That's our BBS, right? Now coming back here, COVID-19 hierarchy of control and behavioral based safety. I hope here there are so many safety professionals. I hope you know this hierarchy of control. It's a very fundamental thing. Risk assessment, after risk assessment, for control, we go with the hierarchy of control. But what is this specific thing? This is for COVID-19 hierarchy of control. So what are the hierarchy of control? It may be CDC, it may be WHO, it may be Austrian Health Center, New Zealand, wherever, whatever may be the health center, everybody is following the same hierarchy of control. The first one, the effective control, elimination. This is nothing but quarantine, keeping yourself away from other people, that we are doing it. There is no substitution, no alternate to prevent from COVID as of now. And now you can see the engineering control is coming up, like using chemical to clean your surfaces. You can go with Clorox. To clean your hands, you can go with alcohol. That is 70% alcohol-based sanitizer. And there are so many other chemicals like OPA, metricide, Chemgene, few other chemicals like benzene, alkanium chloride, BZK. These are the chemicals we can use to, these are the chemicals approved by many of the enforcement agencies across the globe to kill the corona. That's engineering control, we are following it. And then administrative control, like regularly washing your hands, hand wash so with the soap and water, maintaining appropriate social distance, 6 feet, administrative control. And finally, all these controls are there. But what is the only effective control? Now we have a vaccine, right? And you know, everybody needs vaccine, and you know there's a shortage, demand and supply issues are going on, and people are still, people and the health and experts are still gauging which the vaccine is very effective. Still the process is going on. But now, as of now, in my view, generally, if you ask me, the only effective control is maintaining social distance and wearing appropriate mask, right? Even we can see in the COVID hierarchy of control, you can see that community protective equipment, to protect the whole community, wearing the mask and maintaining the social distance is the widely accepted control for the existing scenario now. But here, we know that this too is a behavioral based aspect. Because what is behavioral based aspect? Why I'm saying like that? Even though we instructing the people, even though we are asking the people to don the mask, even though we are asking to maintain the social distance, knowingly or unknowingly, sometimes they are not following it. Which means what? The total COVID hierarchy of control is now depending on this behavioral based safety. I hope I'm bringing the connectivity now, right? There's an OCD that is causing germophobia. Combinedly, OCD and germophobia causing the COVID stress. To overcome this COVID stress, the one way of control we are following now is community protective equipment. That is nothing but maintaining social distance and wearing appropriate mask. Yeah. Yes, Mr. Vaccination is eliminated. Correct. Yeah, but still, Mr. Adil, that vaccination is still under process. But now, to protect the whole community, though the vaccination is in progress, as of now, to protect the whole community, now we can go with mask and with social distancing. Maybe after a few months, and I can understand elimination, we can go with that. But now we have only this, right? Now we'll come with this step into this behavioral based safety, right? In between, I also see the QAs that will help me to go with your thoughts. Great. Eliminate is nothing but to remove completely, right? So, but still, as you know that vaccination is still in progress, not completely covered to the whole population. Okay, there are some countries even the vaccine is not even entered. So this maintaining social distance and wearing the mask is only the effective control as of now. So now that is with the behavioral based safety. What is this behavioral based safety? Observe behavior, analyze the data, generate solution, change the behavior, evaluate. Here, what is the behavior we have to observe? Whether the people are maintaining appropriate social distance wherever required, whether they are donning the mask in an appropriate manner, whether they are donning the mask when they are going out or when they are working inside the office premises. elimination is a kind of staying at home. Yeah, I accept it. It's a kind of a quarantine. Okay, it's a kind of a quarantine. That is also one way, correct? And as Mr. Adel said, we cannot say vaccination is eliminating. Vaccination is actually a kind of engineering control, which is trying to, after there's an infection, it is trying to, the people who already have an infection is in control so that this infection will not happen again. The people who are not getting infected, by injecting it, it's again preventing them. Okay, it's a two-way control, we can say. So coming to BBS, what is observed behavior? We have to observe the behavior, whether the people, community are wearing mask appropriately, whether they are maintaining appropriate social distance or not, and take the data. So you can take a different samples, analyze the data in your workplace, in your office room, in your working area. You can take this survey, how the people are doing it, how many times they are doing this properly. Create some ideas and identify how can we make these controls even more effective. This is the study I did. Like, this is the points I took into mind, as this behavioral based control is very important. I took this study, I took this data. Based on this, I did a survey like this. Pandemic behavioral based safety analysis. So this OCD, this germophobia, this COVID stress syndrome, and the COVID hierarchy of control, community based control, and this behavioral based ideas has encouraged me to enter into the survey, pandemic behavioral based safety analysis. So I conducted the survey for 2.5 months, basically, through a normal Google form and Gmail platform only. I did this survey. Okay. So I received this survey consists of 3 components, but here for the webinar timing, I projected main questions here where I received more responses. So this survey, what I did, composed of 3 components. One is the awareness component. This question I shooted to understand how the community, even though we have a media and even though we have a videos and Facebook, so many other social medias, how the community is well understood about the COVID-19 control, awareness factor. And then complaint factor, this is connected with the behavioral based safety, how the public is responding for this behavioral aspects, how much they are following the hygiene control, how they are complying with the required standards. That is a complaint component. And third one is very important, how the stress is dominating them, the phobia component. So this survey is composed of these 3 components, and based on this, I conducted this basically research data survey for 2.5 months. And I received a response, just a second. I received a response from these countries. You can see that from Iran, you know, after USA, the next most pandemic country, as we know, Iran, now there's a change in lists. Iran 36.66, and then from India next is 30%, and then from Uganda, I know how it reached Uganda, 13.33%, and from Soviet Union, from Turkey, from Nepal, from Spain, from Sri Lanka, from UAE, so 3.3% equally. So I received responses from all these countries for this survey. So for the survey, 76.7% male responded and 23.3% female responded. And if you look at the community, I focused mainly on the worker groups, because you know that construction workers is a huge now. You know, if you take a small construction project, many workers are working. And you can see the chances for transmission is more with them. So construction workers responded much. The people who are involved in quotations and who are dealing with the people much, which means commercial experts, they always have to interact with the people more, commercial experts, lecturers, because one point of time during this COVID period, going to the face-to-face classrooms, even to the schools and colleges, there's a fear for COVID transmission. So lecturers, foremen who are going to the field and site and who are working, HSC managers and trainers, HSC trainers who knows well about this COVID controls, shopkeepers, students, and then occupational pulmonary medical experts, and the people who are volunteers, who are working for the frontline people, who are working for the COVID control, and orphanage home supervisors. Like this, I received responses from different type of audience for the survey. Right. Now we will take one by one what happened and what the survey says. The first one is awareness component. The question is this: is the coronavirus diseases is airborne transmitted? Right? You know that what's the difference between airborne and a normal transmission? Airborne means the virus will travel for some distance. But here in corona, we can say that why we are maintaining that 1.5 meter distance. Whenever I am sneezing and coughing, beyond 1.5 meter, the COVID will not transmit. As of the current researches, what we have, it is not yet completely proved it will travel for some distance. It is limited. You can see the 50% population has understood this idea very well. They are very clear. They want to maintain the 2 meter distance, that is 6 feet distance, that is more than sufficient for them to keep them safe. You can see 50% population is understood very well about this logic, but still you can see the major population, again the 50% population having dilemma about this. Okay, if you just maintain, why I am saying this, come out from the phobia, come out from the anxiety, come out from the fear. Okay, then only we can face this COVID in a very strong manner. So maintain a 2 meter social distance, more than sufficient to keep yourself safe. Great. Next one. Again, there's a mask. You can see there's a colored side and the white side. Which side we have to don? Whether the colored side has to come out or the white side has to come out. Which one has to come out? Again, there's a confusion in this. I want to give an information, then I will talk about the survey result. You know, generally common public, I am not talking about medical health people. I am only talking about the common public where we are using normal 3-ply mask. You know that there will be 3 layers that is preventing this infection to some extent. Okay, and there's a 2 layer. The outer colored layer is an hydrophobic and the inner layer is an hydrophilic, which means the colored layer will not absorb the moisture and the white color layer will absorb moisture, which means the white color layer towards your face, which means if I am coughing, whatever the droplets coming out, that will be absorbed inside. Okay, and if someone is coughing in front of me, whatever the droplets coming from them, the outer layer will not allow the water to stay over it. So as per World Health Organization recommendation, the colored part should be outside, the white color should be inside. This is the WHO is saying it. Now we go with the survey result. Okay, I think that's right. Now we'll show the survey result. You can see 86.7% of the population understood this logic well. The colored side of the mask usually front and while the outside touches your face. Yes, 86.7% of the population understood this logic very effectively, which means what? They have a proper awareness how to wear the mask properly. This is very happy news for all of us. Yes, especially for the health and frontline communities. It's a kudos for them actually. And now, here comes the next important question. Whether hand sanitizing is good or using alcohol, which one is good, right? That's another question. We always have a hand sanitizer with us. I've seen in some restaurants, instead of washing their hands, people are just taking the hand sanitizer out of laziness. They are just using hand sanitizer. They are not washing their hands. For your kind information, okay, alcohol, again, being a chemical engineer, I'm giving a notification. Alcohol, we have 2 types. One is isopropyl alcohol and next one is ethyl alcohol. Okay, usually you can go with 70% IPA, isopropyl alcohol, or more than 70%, is 75% of ethanol, that is ethyl alcohol. Both are very good, right? But what is the effective one is hand wash with soap and water. What's the difference? What's the difference? I told you in my introduction, I'm doing research on disinfection mechanisms. Corona is having a layer. Inside the layer, we have a fatty acid. Okay, if you wash with soap and water, what happens? Soap is nothing but it contains fatty acid. I hope you know this. Soap contains fatty acid. This fatty acid will disturb the corona wall very effectively. Soap and the running water is a very effective hand hygiene method. But however, while doing work each and every time, we cannot do this. So for a temporary sanitation, you can go with alcohol. But before taking food, I am strongly recommending go with soap and water hand wash. That is best and that is more effective. And now see what the community says. You can see which you prefer most for hand hygiene. 43.3% goes with alcohol and 56.7% go with soap and water, which means what? People have a good awareness on this aspect also. So especially again, I'm giving a point. If you are taking food, better don't use alcohol. Go with soap and water wash, running water especially. And after that, wait for 5 seconds to 10 seconds. Your hand has to get dry. Take the tissue paper, dry it, and then take your food. In normal working, you can go with alcohol, no problem, right? So this is giving a satisfactory feel for us. The population understood very well about both hand sanitizing method. That is also a satisfactory response for health community. You can see me each and every time I am saying why I am saying it is good for health community, because I'm also a member of Indian Association of Occupational Health and International Commission of Occupational Health. Back to back, I am interacting with all the doctors, and doctors used to say, sir, we are unable to manage the stress. If there is more corona patients, we doctors, we nurses are suffering a lot. So as a public community, if we follow all these controls properly, being a HSC professionals and OHSC professionals, if you communicate to the community about the controls properly, we can bring this COVID control, we can bring this COVID infection under control. In turn, that will help the health community to treat the already infected patients. If you are not communicating this, if the community is not following these controls properly, what happens? Infection rate will be more and the doctors and the nurses has to face more stress. So if you are following the controls properly, you are not only helping yourself, not only for the community, you are also helping for the health and safety doctors actually. Great. So next, we'll go with the next one. Yeah. So awareness component, what the survey clearly indicates, the survey from the few questions, that's the main important key questions, we can understand the community understand about the COVID control very well. Somehow here and there is some confusion and there is some dilemma. And overall, because of this very strict controls, like you know that many countries have given public places, you have to pay this much fine, that much fine, right? So because of this so many legal controls, now I can say, yes, people are somehow following the COVID control. But however, there are some confusion. So what I suggest is the World Health, like the health protection agencies like CDC, WHO, the Canadian health organizations, like that, there are so many volunteer and enforcement bodies for health and safety organization. They can even simplify the transmission in a video format so that everybody, even a common public, can understand very well. And because of that, the awareness will increase. That is the main point. The awareness has to increase. How much awareness is increasing? The anxiety, the phobia, the fear will control. People starts to follow the control, and that way we can control this infection rate. Great. So just a second, I'll yeah, will come. Yeah, okay, great. Nothing for so far so good. And next we are going into the second component, our topic of discussion, complying component, nothing but how the people are behaving. Okay, they have an awareness. But what's the behavioral safety we are trying to say? Even though there is an awareness, the people has to follow, the worker has to follow, the community has to follow. That's where the behavioral safety is coming into picture. You can see, I put a small icon at the top right corner. I have an awareness. There is a brain and there is a heart. So the brain says do it, but my heart is not allowing to do it. That's how the conflict comes. And now we are going to see how the people following this behavioral aspect of this control. Right, the first question that I asked is, are you cleaning your hands before touching the mask? I want to give an information. I hope you know this. Before touching the mask, you have to sanitize your hand. Through the earring, you have to don the mask. This is the procedure. Now we'll see how much public aware about this, following this particular method. Are you cleaning your hands before touching the mask each time? You can see 46.7% said yes, they are doing it. 53.3% said they are not doing it, which means what? It's the majority now. Then there you can see there is a decline in the behavior. People are not very specific. They have to sanitize your hand before touching the mask. Just imagine you are touching a table and there may be a COVID strain there, and without sanitizing your hands, if you touch the mask, what is the use of it? So here I blame two things: the awareness to be given more, also the behavioral aspect to be improved here. Okay, that's a point one. Next, are you disposing? Another problem. Okay, you are using the mask safely, but are you disposing it properly? Are you keeping in the clinical waste bin, or at least in the closed? We cannot say clinical waste bin in the normal workplaces. At least you have to keep it in the closed bin. How many people are doing it? You look it out. 70% population is doing it. Well and good. So happy to hear it. 16.7%, again 33. Again, you can multiple 30% of the population still not doing it. So don't throw the mask wherever you want. Please dispose the mask in the designated dustbin. 70% population is doing, still 30% population not doing it. So there's an area for improvement there. And next, I have given some picture. Even you can Google it out. The WHO is recommending 7 steps for hand hygiene. So you have to pour the hand sanitizer or soap and water with your palm, and then upper palm, and then you can intersect the palm, and then your fingers, and then thumbs, okay, and then nails, nail heads, and then till your offhand. You have to clean this. This is the procedure. People, they'll open the tap, they'll wash the hands within few seconds, and they'll come back. No, there is no point in doing it. See, in biochemical engineering or even in chemical engineering, we use the term called residence time. After taking any chemical on your hand for the effective disinfection, minimum time to be given, then only the chemical will remove that strain from your hand. But people are not doing it properly. Let's see what the survey says. 60% of the population, they are saying they are doing it properly. Again, you can see 23, 10, again on 10, which means 23 plus 10, 33. Again, 40% of the population not doing it. Again, there's an area for improvement. And why there is a rush? What is the need for rush? The quality time to be only few seconds, 7 steps, follow it and sanitize your hand. Again, you can see there is an area for improvement required in behavioral aspect of hand hygiene things, hand hygiene aspect. Next one. In what occasion are you, this is a very, very important question. In my view, though the vaccine is in progress, still social distancing is equally important. And now we'll see what happens with that. In what occasions are you unable to maintain social distance? Either during shopping, in restaurant, or sometimes during work or other circumstances. You can see 33.3% of the population is trying to say shopping. And because of that only, you can see last week and just a week, 2 weeks before in Melbourne and in other countries, they are doing a lockdown, partial lockdown, mainly after 7 o'clock or 8 o'clock to till morning, because shopping is one way for COVID transmission. People are getting close. They forget about this transmission and this infection. They are getting very close in the shopping. That is why, especially last 2 weeks before, you have seen the lockdown in Melbourne area, right? Because shopping, unknowingly, you can see people start to interact. They don't wear the mask properly. They start to shake hands. You can see their all behaviors. 33.3% population is reported during shopping, they are unable to maintain social distance. And 40% of the population is trying to say, sometimes during work, while I'm interacting with my colleague, while during break time, while taking tea, they are not maintaining social distance. Right? I hope, friends, you know, that doesn't mean if you have only 38 degrees centigrade, you have a corona. Right? I hope you know it. That is one thing called asymptomatic, which means I don't have any corona symptom, but still I have a corona inside. But it is not affecting me, but I am a carrier. Through me, others will get affected. This is the fact. right? So please maintain this social distance, and you can see the population is responding very negatively for this. 40% of the people unable to maintain social distance during work, and 30% of the population unable to maintain social distance during shopping. So if you are a HSC officer, or if you are a trainer or OHSC professional manager or public speaker or a OHSC public health student, please spread the awareness. Maintain social distance till the vaccine is in full force. Maintaining social distance, especially during shopping and during in the workplace. That will bring the corona in a very great level. And you can see restaurant, the next one, coffee shop and restaurant, another place. Another area where the problem is happening, right? However, due to the legal control, we have a safe distance, okay? But still what the people are doing, when they are sitting in a table, they are grouping together, which is not accepted. And that is why in some European countries, especially if you observe it very clearly, during the New Year time and Christmas time, the infection went to some extent. Why? Social gatherings. This is not the time for social gatherings. All this will make the infection rate is progress. Actually, it will giving a more load for the public, for the health community actually. So it is our responsibility to maintain social distance, and the survey is negatively responding. The behavioral based safety aspect of social distance is very not, I don't say it's not satisfactory, I don't say bad, it is not satisfactory. This is one main area of improvement required. Right now, coming to a conclusion, this survey indicates, people are following the basic COVID-19 control, and there are some deviated behavioral changes are observed, especially during socializing in the work environment, in the coffee shops, and also during shopping. So whenever the people are doing this, they have to be extra careful, because I even can say some of my colleagues in the last week, 3 of my friends got infected with COVID. When I make a personal call, what happened? They all said, we went for a mall, we went for a shopping. After that only I can say I can feel the symptom. 3 of my friends say this to me. So please maintain appropriate social distancing during shopping, in the workplace, in the coffee bar, because these are the factors encouraging the infection now. Okay, and from the government bodies, we can say technology control, like instead of using Wi-Fi swiping machines, normal ATM swiping machines, they can give Wi-Fi swiping machine. Meters are available, but still the cost is heavy. They have to bring down the cost. We have a social distance alarms. It's available in the market now, but still the cost is too much. It has to come down so that people start to wear the badge. It's like a badge. If anybody is coming less than 1.5 meter, automatically there will be a beep. Like that, few more controls and proper, even more very strict temperature screenings, everything should be done. So in my view, I can say the survey is clearly indicating that behavioral based safety aspect, especially in social distance, is not satisfactory. And you know this, that is one of the main cause for the infection. Right? This is the main factor for infection. No other way, no party, no socializing. Okay, maintain the appropriate distance in the workplace while doing shopping. That is the only way to keep ourselves from the infection in the existing scenario, until the whole population is protected with the vaccine. So let's see how the population is or overly obsessive. How many people are cleaning again and again? You can see that 43.3% of the people and 20% strongly, which means 60% of the population is worrying, including me. Though I am taking class about OCD, but still I have a hand hygiene, I have a Clorox solution, and I have alcohol spray to clean my laptops. Yes, I have, but I'm not obsessive. I am preventive. I'm not doing again and again. I am a controlled way, right? Awareness is the key. If you have a proper awareness, you know how much to clean. So awareness is the key, right? But still you can see the survey results here. Great. Next one. or actively avoiding situation. But listen, people are not at all going for, even though there is an appropriate social distancing, even though there is an appropriate temperature screening, even though there is a proper sanitizing facility, still people are not coming. This is again a symptom reflection of our OCD and germophobia. Or actively avoiding situations, for instance, places, people, activity, even when they are safe. You can see that 40% of the population agreed, and again you can see 16% strongly agreeing, 33 disagreeing, and 10% neutral. So you can see the disagree is 33. You can see the good ratio here. 40% of the people are agreeing about this, even though the place is safe, they don't go. And 33.3% of the population, they are disagreeing. Please be in the office, if you are a HSC COVID control personnel, if you are involving the biological risk assessment, I am suggesting some idea. In online, you can get a social distancing calculator. You can go there. You can take the measurements of your room. You can put in the calculator. Automatically, you will get an idea how many people are occupied. If you are even more particular about the air conditioned circulation, there are HVAC calculators are available. You can go and you can get an idea how much people can sit with the appropriate social distance with the required ventilation so that corona will not spread. All the enforcement agencies, especially Australian government agencies and New Zealand government agencies and CDC, develop fantastic calculators to maintain appropriate social distance. Believe the scientific facts, follow the scientific data. Okay, everything is available now. Only one thing is we have to go, we have to search, and we have to use it. Okay, so people have equal fear. Some people, even though place is safe, they are not coming. And another major population, if the place is safe, they can come. Again, I am also saying maintain proper social distancing, proper ventilation, clean hand sanitizing, wearing a mask. You can go no harm, because we have to run our life. We have to do our business also, right? And are you spending a lot of time for monitoring your body symptoms? Are you checking yourself whether I have any, because corona symptoms is very different. Skin rash is there, coughing is there, dry cough is there, so many symptoms. So even there's a normal sneeze, everybody starts to look at that person. So how are you spending a lot of time to check your body symptoms? You can see agree 33.3%. And then you can see strongly agree 16.6%, neutral is 23. Again, agree 33 plus 16, we can say 50% of the population checking the body symptoms again and again. Nothing wrong. You can do the self-examination, self-assessment, but get some awareness. What's the difference between a dry cough and the cough with cold? You have to understand the difference between it. Okay. And if you go for nowadays, if you go for YouTube, you can also see some audio, how the corona cough will be. You can match it. But point is, beyond one level, don't do self-examination. We are not doctors. Even doctors, they want the report. So if you feel you have the symptoms, please go to doctors. And before going to doctor, I hope you know that we have a video conferencing facilities nowadays, and many of the hospitals are encouraging video conferencing, because going to hospital is also another risk factor. Only one thing is you have to spend a quality time to find it out. That's it. Okay. So if you feel you have a symptom, and then only you can go, or else don't go to the hospital now. So do the self-examination, self-assessment, but don't overdo. To some extent you can check. And if you feel it, mainly temperature check you can do. If you feel it is you are feeling some abnormality, and then you can, after doing a consultation over telephone, if there is a required, then you go for the hospital. Because I know many of my doctor friends, they used to say, don't come to hospital until it is required, okay? But still you can see the population, 50% of the population doing the whole self-check and self-assessment. And finally, are you scared that your loved ones may affected? Maybe my father, my mother, my wife, my child, they may get affected. This is a predominant stress factor now. You can see 50% of the population accepted they are worrying about, and you can see 26 again, maybe totally 76% of the population can get affected with COVID. Great. So now you can summarize what is this. The survey indicates the phobia is under control somehow among public, but still the emotional intelligence. See, there is something called emotional intelligence. So you can see the social media, and the media is only showing more statistical ratio. Brazil, this much COVID rate. America, this much COVID rate. India, this is the COVID rate. Like that, they are broadcasting more about the COVID rate, but simultaneously, media has to promote what are the mental health and well-being activity, how the people can improve, how the people can overcome stress. They have to broadcast that information also. And being a OHSC professionals who are attending this program and who are volunteers attending this program, please spread positivity among the public. Corona is just a virus, no doubt. It's very harmful, no doubt. But if you have a proper awareness, if you follow the behavioral based safety aspect behind the COVID hierarchy of control, definitely we can bring the infection rate to the controlled level. That will give a breathing space for the health community, the researchers to think more, and there will be more production of vaccine, and even very soon we can come out from this pandemic and we can have our normal life, right? So the overall survey results, I want to summarize this. The overall survey results shows that the public community is effectively complying to COVID-19 control. Somehow there is a fluctuation, there is a confusion. Overall, because of the media and because of the legal bodies and because of the awareness factor, yes, people are somehow following the COVID-19 control. However, there are some recommendations I used to suggest for OHSC people, for HSC trainers, HSC managers, health and safety community, health organizations, for everybody. Based on the survey and this webinar, I want to communicate 3 informations in short. Infection mode to be communicated even more in a simplified manner. Even the communication, the infection mode, even the normal public has to understood very effectively. So the communication mode to be simplified even more better. In the shopping mall, in the workplaces, even though very advanced controls like social distancing meters and more strict supervisions to be enabled in shopping malls as well as in the working spaces. And the media has to promote more mental well-being techniques because people are under stress. So many reasons, as I told you, socioeconomic reason, phobia. Okay, so the media has to promote more mental well-being techniques so that people will feel relief. Don't fear create fearness, create awareness. That awareness will make the people to understand what they can do and what they should not do, and that will improve their behavior. And by improving the behavior, definitely we can improve and we can control this infection. So finally, I want to end up with our behavioral based safety principle, Pareto principle. You can see if you improve 20% of the safe behavior, it is not only for safety. We can use it for business. We can use it for any other aspect. The 20% input to be improved, 80% output will automatically get. What is the 20% input here? They're talking about Pareto. 20% input for Corona is give the awareness, give the understanding, make them to know what they can do and what they should not do at all. Okay, whenever if somebody is deviating that, intervene them. Say in a polite manner, they have to wear mask, they have to maintain social distance. Like that, each one of us as a chain, how the Corona is spreading like a chain, right? Same way, if all the human community combine together and if they give this input, awareness factor to the whole community, naturally, everybody, the safety behavior against Corona, they will follow it. And if they follow it, definitely we can break the chain and very soon we can come to our normal life, right? So at this moment, I want to thank the doctors and nurses. If anybody is coughing and sneezing, we people not even going near to them. We are maintaining a very, not only social distance, we are running somewhere else. But think about the doctors. They are also human. Just completing a degree doesn't mean they don't have a human organ. They also have a human, they also have a relations. I hope you have seen so many YouTube videos. Maybe he's a doctor, he's unable to hug his son or daughter because he's having a fear. Because of him, the infection may happen to his daughter or son. this emotional trauma, you can see even doctors are getting affected. And you have seen in so many YouTube videos, consistently nurses are wearing the body gowns and aprons and COVID suits and masks, and you can see the face swelling because of that. Okay, if the infection rate is more, you are giving a load to the health community. They cannot research properly, they cannot do the service properly, and we are giving indirect stress for them. So controlling the community, controlling the infection by proper awareness, following the proper behavior is each of our responsibility. By doing this, by improving this behavior, I am very sure very soon we can break the COVID chain and we can back to our normal life. Thank you so much for the attending the session. Yes, back to admin. Yes, sir.
Yeah, thank you so much, Jayandran. It's always a pleasure to have you on these webinars, and I'm quite impressed with the way you were taking questions on the go. I do apologize to most of you that towards the start we had some bit of technicality, but I would also hope you'd understand that Mr. Jayandran, from where he's actually hosting it, did manage to find a solution and to continue on with the webinar. Now, for those of you who would have joined us in between or who would have missed a certain part of the webinar, please note that this is recorded. It's being recorded as we speak, and this will be put up on our website pretty soon. In fact, it would go up on our websites in about 48 hours from now. So all you need to do is just visit our website and check the webinar section. You will find the details and the link, the video link available there for this webinar. Right, and some of you had asked questions that when would be the e-certificate be available for those attending this webinar. Please note that the e-certificates will be emailed to you from, let's say, within a week's time from today, because there's a lot of back-end processing involved. We would get your details and the final list only after 48 hours. We need to process that. Now, I would also request that there are some of you on this webinar who have joined in with their names displaying their device. So please make sure that if it is device, you need to change it to your display name. The names that have appeared on this webinar is how it would be picked up, and that is how it would come up on your certificate as well. So please make sure that you change your display name on. You still have time, so there is it doesn't matter, it would automatically resolve and it would get into our certification department. Once again, the certificates would take at least a week, and it would the soft copy of the certificate. It's only a soft copy certificate. Please note, it's a webinar soft copy certificate of attendance, and this will be emailed to your registered email address automatically after a week. Right. So before I conclude for the day, if I can request Jayandran to stop sharing on the screen, and I will share a contact detail on. Yeah, thank you, Jayandran. So, all right, let me just bring that up. Okay, so what you see on your screens now is our contact number. Please feel free to reach us on this number, and we will be more than happy to. Or you can even send us a WhatsApp message, or you can even write into us at webinars@greenworldsafety.com. Right. So these are the two email addresses, and we will be more than happy to respond there. Any messages that you send on WhatsApp, please note this is a business WhatsApp number, and you will. Let me just bring this up on screen, full screen, so be able to see it, and I can leave it on the screen as we conclude the session. So please take a note of this number and the email address, and feel free to write to us. We would make sure that we would respond during working hours. To conclude, it's been a pleasure to have you all this evening. Thank you so much for joining us on this webinar, and please stay tuned for several such events that we have over the coming months. We will be discussing on different topics. We would also be having Mr. Jayandran back very soon on with a different topic, with a different perspective. Please proceed, Jayandran.
Sir, I want to answer for a few questions quickly.
Please, all yours. I'm just leaving the
Sir,
screen as it is, but all yours. You can take questions as well. No problem.
Sure, I'll do that. Okay, from Mohan Mukherjee, there's a question. I will answer all the questions. I have enough time. Okay, I am doing this webinar for awareness. Okay, awareness is the main idea for myself. Okay, so do you think more webinars are required, Mr. Mukherjee? Yes, Mr. Mukherjee. Now I gave the webinar. I am not a virological expert. I am learning myself. Same way, this webinar, what Green World is giving to us, a very great opportunity. We are coming to your doorsteps and we are arranging this webinar. You get an idea now. Go for WHO sites, go for CDC site. Authentic informations are available. Don't explore unauthentic data. Go for WHO, go for CDC, download the data, definitely get an idea. And you can also do it, Mr. Mukherjee. Thanks for asking that question. And from Harshit Dikshit, how to overcome from OCD? OCD is just a psychological disorder, Harshit. Awareness is the only way, Harshit. Awareness. You have to get an idea how the COVID is spreading. If you have a good awareness, automatically OCD will go. So the key for come out from germophobia, especially COVID phobia, is get proper awareness. That's it. And yeah, I can see there's an interview. Okay, voice is not clear. Okay, sorry for that. I tried. Many people are connected. Okay. Yeah, sir, can you explain about xenophobia? Xenophobia is nothing but, I don't want to name a country because it is against my professional ethics. I don't blame any country for this, but we know that, right? In a specific country, infection rate is more. So if anybody is coming from that country, we don't talk with them. Because we will identify some country the corona started, only some people are having this infection, we'll keep on avoid that particular country. That is xenophobia, no need to worry for that. Now it is globally spread that we cannot blame anybody. Okay, vaccination is to eliminate. I told you, Adil, during the session itself, yeah, it's a two-way process. As of now, the people who are infected with vaccine, you know, I think you have said about the COVID vaccine, it is acting in the two-way. Already if you have an infection, it is controlled. And the people who are not having infection, if you take it, it will also control. So two-way process. Yes, this vaccine is part of the control, but still, as you know, Mr. Julius, but still the vaccine, the production, demand, supply, and you know, many countries have some procedure. First of all, they want to give for frontline people, then for the government servant, and then for the school teachers, and then for the elderly people, and then for the public community. It will take time, Mr. Julius. Everybody vaccinated, it will take time. Each country have their own norms. Okay, till now, till that time, social distancing and mask is the only call for us. Which yes, as by injecting vaccine, I don't say it's eliminate now. That's why I told you it's a two-way process. Anything in advance, proactive is elimination. But now already spread that. We can take it as an engineering control. But yes, the people who are not infected, yes, we can take it as an eliminate. Yes, elimination is yes. Better, yes, Mr. As Charles said, elimination is quarantine. That is one way. Exactly, we can say staying isolation is a better example for elimination rather than vaccine. Okay, you have a challenge. Okay, as per WHO, vaccination will not protect against spreading. Yes, that's why I said the research is going on. Each company is giving some report. Okay, still it has to be confirmed. It's on the way, on process. I think few questions I can. Hot water, no, Mr. Kalisaran, please come out from that fact. Hot water will not kill this particular virus. Come out from that false belief. Why don't Indian hospitals have? Yes, Indian hospitals have an HSC officers. I know that they have it. They are trained on it, but we cannot say in all the hospital. But if few hospitals, we can see it has to happen globally very soon. How do we educate ruralist people, less communicated people? No way, Mr. Tariq. I don't have the opportunity. Maybe in future, if I get, we have to go there, we have to talk with them. Okay, only by communication, direct communication with a proper protection. But first of all, you have to keep yourself safe while communicating it. Direct communication, they are not that much educated. Just by pamphlets, they don't understand anything. We have to go and we have to talk with them directly. Yeah, very good question from Mohammed. People are using cloth mask. Is it okay? Some people are using non-medical mask. See, Mr. Mohammed, Cloth mask, you can use it. As you know, you have to disinfect it regularly. You have to take the normal soap and water. You can soak it and keep it for natural drying it. And after cleaning it, again in the sink, you are cleaning in the sink, right? After cleaning it, one more time, wash the sink very clearly. Drying is very important. Okay, some of are using non-medical mask. Yes, we are going with a 3-ply mask, and some people are covering the face with a cloth. No use at all. No use at all. We have a cloth mask. We have a 3-ply mask. Apart from that, we cannot go with a surgical mask. That is why mainly for health people. We people can go with a 3-ply mask or the approved cloth mask. Don't cover your nose with a normal cloth. There is no use of it. Good question from Mohammed. Prompting evidence-based policy, promoting, yes, we have to. That's why I said, Mr. Nazir, go with WHO, go with CDC, get the authentic data. Evidence-based data is the only way to create awareness. Thank you very much for your time. Okay, thank you. And any other questions? My suggestion is no need for online meetings. We must people aware to different modes on ground, not online. Correct? Yeah, but to some area we cannot go physically. What to do? So now we can do by webinar. We connected so many people. The corona, we have a holes, like we have a nostrils, we have a retina, and we have a ENT. That is our ear opening, right? The possibility that you have to take the likelihood. The possibility of infection is very more with your nose and the mouth, not through eye. The chance is very less. That doesn't mean you don't need to wear goggle. But it's not recommended actually. Mostly the infection is happening through your nostrils and mouth and through the respiratory tract. Okay, after vaccine, it's enough to control the corona. Vaccination, yes, it's good, but that doesn't mean don't take it for false security. Vaccination still getting under evaluation. We have to wait for some more time to confirm this. How many coming years? Yes, go for vaccine calculator available. It will take some time, not years, mister, but it will take some time. I answered most of the questions as much as possible. Thank you. Right.
Thank you so much for that, Jayandran. This is one of the reasons, we always call Mr. Jayandran as, in Tamil we have something called as quick gun Murugan. So he's like quick gun Jayandran. He always manages to make sure that no question is left unanswered. And I should also mention that Mr. Jayandran, apart from just delivering this webinar, apart from his work schedule, on a personal note, he's one of the finest individuals that I've known who has dedicated his cause for question knowledge. I've had some very healthy discussions with him, and you name a topic, he would always find a way to. If he's not able to give you an answer, then his next quest is to come back to you and make sure that he finds an answer for you. That's how Mr. Jayandran has been. So I really like to thank Mr. Jayandran for having been a part of this webinar, and we would surely be looking to have Mr. Jayandran back in one of our episodes in the near future. So with that, we'd like to conclude the session for today. Thank you once again, and I'll leave the contacts that you see on your screen for another minute or two. You can please take note of it, and then once I've ended the session, your screen will be completed. Once again, have a pleasant evening, stay safe, and please make sure that you take care of yourselves and those around you. Thank you, and have a pleasant evening.